The Ontario Medical Association's latest media briefing was dominated by questions surrounding whether the province has in fact entered a so-called third wave.
This is what we know is the normal COVID as we know it is on the decline, but variants are on the increase. And so what we were seeing, I can say in specific for Toronto, we were actually plateauing. Our cases were plateauing. Now they're seem to be on the upswing, and the reproductive number, which is a key number, is higher than 1. And when it's higher than 1, it means that each person who gets COVID is more likely to spread it to more than one other person. So that's certainly a sign that our cases are increasing. I think to say that we're in a third wave, you have to really show that you have increased case rates that have been sustained.
The vaccine really is the answer. This is our shot to stamp this, to flatten this. Is it going to be there in time for this third wave? That's hard to tell because it's hard to see how quickly we're going to get vaccines in arms, in patients, in people, in the population. But that certainly has a key thing to do with what we're going to see with this third wave. As for the effect on hospitalizations and deaths, Dr. Bogosh mentioned it before he left, is that the biggest impact has unfortunately been in our elderly and our marginalized communities. And I'm hoping that those are the ones that we make a huge emphasis to vaccinate first. Is it going to be quick enough? That part, I think time will tell.
Booster doses are something that's common with a lot of different vaccines, either to change the vaccine slightly based on a new strain that's circulating, which is what we do for influenza, or for other vaccines like our pneumococcal vaccine to prevent pneumococcal disease, we give booster doses. So I think the good news is that's something that we can look into, and certainly the science can actually reassess that and, if needed, provide it. The other thing to note, though, is that even if the current vaccine doesn't provide the exact protection for which it was intended, there's often cross-protection. And we see that with flu vaccine every year as well, too. And so the current vaccines, even if the virus continues to change, will provide often a level of protection more than without being vaccinated.
With vaccination clinics opening up across the province, Dr. Dubé wants everyone to feel confident that the sites they attend to get a COVID-19 vaccination are safe.
And so I do want people to know that when you come to a COVID vaccination clinic, there will be measures in place to ensure that you will be protected there and are not going to catch COVID there. And that includes that pre-screening to make sure that you don't have symptoms before you come. And if you have symptoms, that you can re-register and change your appointment date. And then all of the measures that will be in place, the physical distancing, the heating and ventilation, making sure that the staff are wearing PPE, that the clients are wearing their masks. And then the real bottleneck actually in clinic space is the aftercare, where everyone is to stay for a minimum of 15 minutes. And that's where you actually, getting the needle in the arm is actually very quick and painless mostly, but you need enough space to be able to have people monitored. And I think the point on drive-through clinics is they can be done quite well and quite safely, but you need to be able to have a mechanism in place to be able to watch people afterwards so that they can stay for their 15 minutes.
More information is available online at askonteriodoctors.org. In Niagara, you're watching The Source on your TV.